Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, JP Nagar, second phase. Yes, PMS becoming worse after childbirth. This is natural because there are so many causes for the PMS to become more aggressive after childbirth, because as a mother you are feeling challenges of life more than what it was when you have not yet had a child, because having a child is an extra responsibility for you, because you are going to look after the child, and being mother is something different. You have to become everything for the child, and in your young age you will have much energy to do all these things. So if you have conceived and delivered at a younger age, it is better. And these days there are mothers who are being very much aged by the time they deliver, and they cannot handle these things efficiently. And premenstrual syndrome is naturally happening to so many ladies because of the hormonal changes that happens during the menstruation, because of the alteration in the routine hormones, that is the estrogen and progesterone. The causes of this PMS becoming worse after delivery is that you have become more responsible now after becoming a mother, because the changes are more. What happens in PMS is there is a sudden reduction in hormones like estrogen and progesterone, and after delivery also our whole system is not set fully, because that hypothalamus, pituitary and the ovaries are not properly inclined immediately after delivery, and so there is irregularity of hormones, and the routine cycle that happens in all ladies will not be set properly immediately after delivery, and this is the reason we will have more problems of PMS post delivery. Because one thing is, you are already a mother and you have to look after your routine activities, along with that you have to do lactation and feeding of the child, and child will not be a person who can understand everything, because it cannot talk with you, it cannot understand much things. So you have to sense everything about the child, and you have to change yourself according to that. Most important is feeding the child regularly, and child disturbs you in odd hours and you will not be able to take your routine rest and all those things, and because of this the problems of PMS will become more worse after delivery. That is natural thing to happen. Hormonal changes that can happen regarding PMS after child delivery. See, what is the thing that happens is, in a normal PMS it is routine that it is just before menstruation there is a sudden lowering of the routine hormones of estrogen and progesterone, whereas in a person who has delivered, that is a person who is mother, there is one more hormone coming into picture, because she is a lactating mother, and lactation, as you all know, is involves one more hormone, that is prolactin. There is increase in the prolactin levels, and because of increase in the prolactin levels only lactation will be happening. And when this prolactin increases in the blood, there is natural suppression of estrogen and progesterone to a certain extent, because in normal ladies also there is one problem called hyperprolactinemia, in which because of that hyperprolactinemia the periods gets changed, means there will be occurrence of amenorrhea, means absence of regular periods because of increase in the prolactin. So in mothers who are lactating, that is feeding the child, their prolactin levels are increased, and because of increase in the prolactin naturally there is reduction in the estrogen and progesterone. And as I told you, after delivery, when the whole system of pituitary, hypothalamus and the ovaries are disturbed, it has to just get adjusted again to develop the routine cycle. Till then it may take a few months, and till then the periods may be irregular, and because of that also there is a problem. That is the difference in the mothers when compared to the routine ladies. So this is the reason, and it will be a taxing thing for the mind of the lady also, and it needs real strength and real mental stamina to take over this change, and you have to try to adapt yourself to this change, understanding what has happened. And if you are not able to do this, means if the problem is a very big one, it's better you go to your doctor who has looked after you as a pregnant lady and who has delivered you, and she will be calmly able to give you solution for what all problems you have after your birth, that is the increase in the PMS that happens after delivery and during the lactation period. All these factors, that is stress, sleep deprivation and nutritional deficiency, has definitely an impact on the premenstrual syndrome after you become a mother. Most important thing, but that is stress. the stress of becoming a mother. Now this lady who was just a lady has to become a mother, means she has to be nice to her child, she has to be nice to her family, she has to be nice with her husband, and this becomes a really taxing problem. Because of these, there are some psychological changes in our body, and because of that also there is worsening of this premenstrual syndrome. And one most important thing is, first thing is stress, that is stress of facing the family. There are so many things that happens when you deliver, because just a simple thing like sex of the child. Sex of the child, each person in the family reacts in a different way. Most important in our Indian families is the uphandedness of the mother-in-laws. If they do not like the sex of the child, they try to torture the mother, and that will have an impact on the mother. And next is the sleep deprivation. Sleep deprivation is a very, very important factor, as I have seen in my practice only. Because the mother cannot sleep properly as she used to sleep before, because her child will always be disturbing the night only. And especially immediately after delivery, most of the nights the children are awake and they are continuously crying. And not that all mothers will have somebody to assist them in looking after the child during the nights. So naturally she will lose her sleep. Because of sleep deprivation, she will become more cranky and she will not be able to handle the situation daily in her morning life. So this is one of the most important factor. And one more thing is about nutrition. Naturally, nutrition, that is deficiency of proper nutrition, will have definite effect on the mother. The reason is the mother's capacity to lactate will depend on the good nutrition that she takes. And if she does not have a proper diet, she will definitely reduce her milk production. And milk production reduction will have not only impact on the mother, it will have impact on the child also. It cannot talk, it will just be showing it in the form of crying. And when the child cries more, the mother gets more disturbed mentally. So these are all very important factors which can have effect on the mother. So always I tell that the people around the mother should always be helpful to her to handle this situation, so that the aggressiveness of the PMS that is manifest is reduced to a certain extent. PMS is a routine thing that happens in all routine ladies, and it will become more aggravated in the postpartum lady, that is after delivery, as I told you previously. But when PDD comes, it is a more worse form of PMS, that is it is a premenstrual dysmorphic disorder. In dysmorphic disorder, there is some intense effect on the psychology of the mother. This is the reason it is called as premenstrual dysmorphic disease. See, in this case what happens is, it will have affected her so much mentally that she will behave much abnormally with her people around her. That is, she will have severe depression, she will have too much of anxiety, and she will have physically also she will be very exhausted. Because of that, she behaves very much differently, and this will look very much odd for the family around her. So this is definitely different from the routine PMS. What you have to do is, when the things become abnormal, one thing is you have to take care of yourself also. Most of the time a lady's habit is she tries to take care of the society, the family, and she neglects herself. And this form of action done by her will worsen all these problems that happens after delivery. So she has to keep in mind, back of the mind, that she has to take care about her food, about the type of nutrition she is having, about the rest she gets, and about the society, that she should know that society, that the immediate society around her may behave abnormally with her. She has to become more strong mentally, and she becomes more strong mentally, she can handle her immediate family people around her, and because of that she can take care of all this PMDD and other things much better.